All right, breast augmentation is the second most popular plastic surgery procedure in the country, but there are still a lot of myths that exist about it. Joining us this morning is board-certified plastic surgeon Dr. Vince Marin. He's here to separate fact from fiction. Thank you for being here as always.
My pleasure.
I love it when our producers try to pop quiz me on things they know I know nothing about. Let's get right to it. We have a little pop quiz going on here. Our first thing that might be a myth or it might be the truth is that a lot of people believe you should wait until after children in order to undergo breast augmentation. I'm going to say that this is false.
You're right because it's both true and false.
Oh, okay.
So it's kind of a trick question. They try to stump you in the very beginning. Breast surgery is the second most common thing we do. We see it all the time, but with respect to childbearing years, there's no reason you have to wait until you're going to have children to have a breast augmentation. However, if you are planning on having one in the near future, I'd say if someone was in a family and they're planning on having children, actively trying, I would say wait until after. It doesn't affect and shouldn't have any effect on breastfeeding potential as it goes through. However, your breast will change with pregnancy and breastfeeding. So the reason we say wait if you are actively trying is the fact that there are going to be some changes that happen with the breast. So you don't want to set yourself up for a second surgery. However, the vast majority of women that we get are well before they're in that part of their life where they're trying to have children. So there's no reason you have to wait until after unless you're actively trying. It just makes more sense to try to wait, not set yourself up for two procedures down the road.
Gotcha. Very good. All right, let's get to our second one. And this is another true or false question. You have to replace them every 10 years. I'm going to say that this is false.
You're absolutely right.
Yeah.
So far, yeah, 2 for 2, right. There was a myth that's always come up. We hear it all the time that you're supposed to replace them at 10 years. The reason is they used to be warranted for 10 years, and then everyone felt, well, once that warranty was kind of out, then they had to do something about it. I've seen intact implants in for well over 30 years. They're currently warranted for life, and what we tell most patients is that if you're not having a problem, you're happy with your appearance, and you're not having any issues, leave them alone.
Yeah.
Enjoy it, don't worry about it. Now, the one thing is a lot of women think, well, I have them done, and 10 years later, you're 10 years older, so there's some other changes that may happen, but there's nothing about the implants that would force you to have to change or go back in and replace them.
All right, next one, true or false? They can leak. True.
Very true. This is something, the saline implants, when they leak, for lack of a better example, you kind of end up with a flat tire on one side.
I know people that this has happened to.
And it really is dramatic, and you will see it happen right away. It's pretty obvious when that goes, and the issues are there's really no health risk related to that. Saline implants will leak, your body absorbs it and gets rid of that fluid. However, there is a true cosmetic problem that happens. As you can see in this mammogram, you can see in the patient on this one side, this is what you'll actually see is that implant will collapse, and you'll see a lot of difference in terms of the shape and the folding of the implant. Now, there is one difference with a silicone implant is that there is a small amount of scar tissue that forms around that, what's called a capsule. And when a silicone implant leaks, the new gummy bear types, they don't collapse. You have what's called a silent rupture. And the only way to make that determination is through an MRI. So a patient that has a silicone implant could have a rupture, but wouldn't see that dramatic change that you'll see with a saline implant. If you do suspect it, you go back to your doctor. It's not a health risk, but it is something if we suspect a rupture, we'd want to replace that to a new intact implant.
You'd want to get it taken care of.
Absolutely.
Okay, next one. True or false? They'll never look natural. This is a subjective one.
Very
this one's
true.
kind of not fair,
Yeah.
but I'm going to say for your purposes, false.
Thank you for that.
Says the plastic surgeon who does them.
Very true. I have a little bit of a bias. That being said, if you choose the right implant in the right patient, you can have a very natural result. We picked a Kate Hudson picture today, and there's
You're welcome, everyone at home.
Yeah, there's suspicion that she may have had a change, in her appearance in that area, but no one would accuse her of being over the top and obvious in that respect. It could also just be a really good bra. Victoria's Secret is amazing at what they can do. So that being said, there are ways in which you can have it look natural. Some women elect different choices in terms of what they'd prefer. So there are some that are obvious, and those are the ones that everyone sees. But what I tell patients is you miss all the good ones, you see the obvious ones that are out there. So there may be women or friends that you have that look a little better, but you're not sure why.
Yeah.
It could have been that they had it, but it does not have to be obvious when
over
you have
the
a
top.
breast
Okay,
augmentation.
very good. You're very careful there.
I'm trying.
Let's get to the next one. True or false? Placement below the muscle is better. I don't know about this one. I'm going to say yes.
Yes, yeah. 100% on that quiz, I think, so far. It's better for a number of different reasons. The first and most important from a patient's perspective is mammogram health, your breast health. So it's much easier to see the breast tissue when that implant is placed beneath the muscle. So when that happens, you're better able to visualize the breast tissue. It's better. And if you can see in some of this on that what's called subpectoral, that's beneath the muscle, this muscle is what's covering that implant. This is what we call subglandular. Beneath just the breast, the muscle is left on the chest wall. So number one, you can better visualize that breast tissue in a mammogram, so it's better for your breast health. Number two, it actually looks better. So you add more of the patient's own material in front of the implant. It will camouflage it better. Again, looks more natural, can hide some of the imperfections of an implant. And then the last part is that it's actually better for long-term complications. So there's three different reasons to choose that. In the United States, I'd say the vast majority, 90–95% of patients are having submuscular, under the muscle breast augmentations.
Interesting. All right, lastly, true or false, you will lose some sensation. I will say no. Yes. It depends on the person.
There you go. It's more anatomy more than anything. In this situation, again, vast majority of patients shouldn't have any permanent change. We're talking maybe 1 to 2%. The reason is where the nerve exits. Now this is a little bit more anatomic. We're looking at the side of an individual, and the nerves actually emerge along, this is kind of the arm raised up along the side of the chest. So most women and patients that come through think that they're going to have some sensation changes that are absolutely going to happen, especially if the incision is around the areola. Those types of things are not true. It's where that nerve emerged from the side of the chest. Most patients will have a temporary change, so they're going to have either the sensation will go up or down, but that usually lasts a couple weeks. I'd say 98–99% of patients have no permanent change in sensation. It shouldn't be a concern for most patients. It's, you know, anytime you have any operation on the chest wall, it can happen. That being said, it's a very, very safe procedure.
Okay, very good. Dr. Marin, thank you so much. We appreciate it. If you'd like to get in touch with Dr. Marin at Marin Aesthetics, they're located in Del Mar. The information's up on your screen. We've also got it on our website, fox5sandiego.com. Just click on the Scene on tab. Raul, back over to you.